So that's it for anaphylaxis. Make sure you have a good understanding of that. I'm going to move into spiders. So there are actually 37,000 different species, more or less. They're actually all venomous, but 50 U.S. species only can bite humans. So that's not very many. And then of those, only 15 of those species produce any kind of symptoms, and only 2 of them are dangerous. And you've probably heard of these. They're the black widow and the brown recluse. Neither of which this guy is. I think that's just kind of a cool, hairy-looking tarantula. So the black widow. This is actually fairly big. I mean, like this is probably 1.5 inches on average. They have a really, really big belly here. Only the females bite. They have the little kind of diamond shape on them. So they tend to be in wood piles. Their webs are very irregular. They may be in trash dumps, outdoor structures, and under rocks. They're occasionally, but really honestly rarely, in houses. And the females actually rarely leave webs, and only the females bite the humans. So, yeah, that's the black widow. The black widow, and pay attention to this, the black widow is neurotoxic. The bite presents with an immediate sharp stinging pain, and it can lead to muscle cramps in 15 minutes to 2 hours. If it's an upper extremity, then you are likely to have pleuritic chest pain, so it's just going to hurt to breathe shortly thereafter. If it's a lower extremity or genitalia, then you'll have abdominal pain and rigidity. Following that, you'll end up with muscle twitching, weakness, paralysis, and drooping eyelids. You can end up with sweating, tearing, salivation, and increased bronchial secretions. Anxiety, headache, restlessness, dizziness, nausea, vomiting, hypertension, edema, skin rash, conjunctivitis, itching, shock, and respiratory depression. The symptoms will usually peak in a few hours and then diminish. They usually last less than 24 hours, but some are symptomatic for up to 4 days. Most do recover completely, but it's really uncomfortable and kind of a scary experience, and one that should still be spent mostly in a hospital under close supervision. The treatment here, local cold packs. So we put cold packs on them. Symptomatic care, and there is an antivenin. So call the hospital, tell them what you got coming in. It's not something they usually keep on hand. They have to usually get it from like some sort of academic institution that keeps it, or have it shipped in from another location. So call as soon as you recognize that that's what you have. All right, the next one, the brown recluse. This guy's pretty big too. This is not your standard house spider. It's called a fiddleback because he kind of looks like a fiddle, I guess. I never really saw the fiddle on him, but I guess some people think he looks like a little fiddle. He's found in the southeast, south central U.S. He's found in Texas, locally. There's a related species in the desert southwest. These guys are shy and nocturnal. They tend to be in dark closets, basements, on floors, behind furniture, in houses. So they kind of hide. They're really shy. They don't like people. They don't like light. They only come out at night. So the brown recluse, this is kind of a scary one. It actually kind of eats the flesh. It's a necrotic type tissue, or necrotic type toxin, I mean. There tends to be no pain or only mild stinging. You'll end up with, in a couple hours, you'll have local pain and kind of this blue-gray halo here. You can kind of see it here, kind of that bluish-gray color in there. From 12 to 18 hours, you start with a blood formation and a growing ischemic zone. And in 5 to 7 days, you'll have an aseptic necrosis, or some sort of necrotic ulcer, which you can see here. This is starting to form an ulcer. Severe lesions may be up to 30 centimeters in diameter. You can get some systemic signs and symptoms. The mild signs and symptoms would be fever and chills, malaise, just generally not feeling well, nausea, vomiting, and joint pain. Severe symptoms may be bleeding disorders, renal failure, convulsions, heart failure, and even death. Pre-hospital management, you do put a cold pack on it. You clean any wound there and use a padded splint with bulky dressings. Scorpions. Ew, yuck, creepy crawlies, gross, not my favorite. Okay, so there's only one potentially lethal scorpion in the U.S., and it's primarily in Arizona. If you work in far west Texas, New Mexico, California, or northern Mexico, you may see it somewhere. Fortunately, they don't tend to hang out around here. We do have scorpions here, but not generally toxic ones. So for the toxic one, local signs and symptoms, no local swelling, inflammation. There will be local pain, and this is the big thing. People get stung by scorpions on a fairly regular basis, and it hurts. I mean, like, people are really concerned because it hurts so bad. Like, it really hurts, and then the area around it is hypersensitive, so it just hurts, and then, like, you barely touch it, and it's like, oh my gosh, that really hurts. The same is true with the toxic one and the non-toxic ones. They're all going to hurt. But let's see, what else? The systemic signs that you'll get with the toxic scorpion, extreme restlessness, agitation, kind of roving eye movements, poor coordination, slurred speech, difficulty swallowing, salivation, wheezing, stridor, tachycardia, tachypnea, hypertension, nausea, and vomiting. I mean, goodness, you name it. It can come with the scorpion sting. Treatment here, antivenin. There's really only one place to get it, and that's Arizona State University. It's their National Venomous Desert Animal Study Center. So if you suspect, if you're working in an area where this guy is endemic, where you can find him, then you have to call the Arizona State University Venomous Desert Animal Study Center, and they will ship you as quickly as they possibly can some of the antivenin.